Good day, everyone. I am Christine, the moderator for this webinar. I welcome everyone to today's webinar, that is Understanding the CMS Final Rule for 2025 in BECS Strategies and Compliance. I would like to introduce our presenter for today, Jane Haley. Jane Haley, MHL, CMC, CMCO, CMIS, CMOM, CMCAEM, has more than 30 years of experience in healthcare. I would now like to hand over the floor to the speaker. Over to you, Jane.
Okay, thank you so much, Christine, and welcome everyone to today's webinar on the CMS final rule. The final rule came out in November, and of course, many changes are taking place this year, starting January 1st, and we're still learning things about the final rule. So some of the things that we'll be covering today, we're going to look at the conversion factor. The conversion factor is so important to understand because it directly affects physician payment. CMS continues to increase caregiver training services, so there's some new things for 2025 there. We'll also look at social needs. There's some changes with that visit complexity add-on code that started in 2024, so I'll give you some updates there. Telehealth has really been I don't want to say confusing, but it has been the section of the final rule that I think has provided the most confusion. So hopefully we're going to be able to give you some clarity there today. And then there's other updates, as you can see, everything from updates to Medicare Part D drug coverage, infectious disease, and so forth. So we do have a lot to cover in the next hour. Let's start, though, by looking at the physician fee schedule. So the Medicare Physician Fee Schedule final rule for 2025 establishes the policies, payment rates, and quality program updates for services furnished by healthcare providers to Medicare beneficiaries in the upcoming year, so in 2025. The Physician Fee Schedule final rule is published annually by CMS, and this rule is a cornerstone of Medicare's approach to ensuring high access to high quality care while promoting efficiency and innovation. Key changes for 2025 include adjustments to the conversion factor, refinements to the relative value units, modifications to the quality payment program, and policy updates impacting telehealth, chronic care management, and behavioral health services. All right, let's start out by talking about the conversion factor. So the conversion factor, as mentioned, is updated annually by CMS. Now, this slide here shows what we've been dealing with over the last several years. Another change for 2025 are the 2025 premiums, deductibles, and coinsurance. So each year, the Medicare Part B premium, deductible, and coinsurance rates are determined according to provisions of the Social Security Act. All right, let's look at caregiver training. So here's our codes, GO541. This code covers caregiver training and direct care strategies. Now GO542, this code represents an additional 15-minute session. And then we also have GO543. It applies with multiple sets of caregivers. All right, for 2025, CMS has issued a broad request for information on the newly implemented community health integration services, principal illness navigation services, and social determinants of health risk assessment is with our complexity code G2211. All right, telehealth services. Telehealth services have gone through some change since November of 2024. All right, so at the end of 2024, Congress passed a long-awaited law called the American Relief Act of 2025. So this law includes a continuing resolution, which is a temporary measure that keeps certain government programs funded and running through March 31st, 2025, instead of allowing them to expire. So let's take a look at the waivers that were extended. So for calendar year 2025, CMS has added several services to the Medicare telehealth services. All right, another telehealth change. Effective January 1st, an interactive telecommunication system. All right, a few other things with telehealth. So CMS continues to expand care management services, and there are several key reasons behind this effort. It supports primary care transformation, simplifies billing, and fosters accountable care. Cardiovascular risk assessment and management codes. Okay, we do have some changes for behavioral health. CMS finalized several measures to support access to behavioral health care, aligning with its behavioral health strategy. Let's take a look here at these codes I mentioned. All right, CMS also finalized updates for opioid use treatment services by opioid treatment programs. So CMS also introduced a new HCPCS add-on code for calendar year 2025 to capture the intensity and complexity of inpatient or observation care for confirmed or suspected infectious disease. CMS also is expanding the use of transfer of care modifier 54 for all 90-day global surgical packages, allowing it to be applied in cases of both formal and informal transfers of care. All right, so for therapy, there's a few changes. For calendar year 2025, CMS finalized a change. All right, we have a few other updates that I'll quickly go over. A few other updates. Immunosuppressive therapy. In calendar year 2025, we have the elimination of the coverage gap or the Medicare Part D donut hole. All right, so this is how it looks. All right, so that brings us to the end of our presentation today. Thank you very much, Jeff. I'm glad you enjoyed the presentation. So we've covered a lot of information today, but there are a couple takeaways that I would really like you to consider. One is stay tuned for telehealth. Remember that those waivers are only in place until March 31st. So keep up with any bulletins that you're receiving from CMS and so forth on the telehealth. The second thing I want to mention is the G2211, that complexity code. And then the other takeaway is be prepared for questions from your Medicare beneficiaries on their drug plans.
Thank you, Jen. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and have a great day.